Hi, on this video I'm going to be talking more about head injuries, why they happen of course, and how they can start to affect the local area around the head and the neck, but really what they can start to do and how they can affect your overall general health and affecting other types of diseases and health conditions. So one of the reasons I talk a lot about head injuries is because here at Vitality Chiropractic I really specialize in what's happening at the top part of the neck. And especially if someone has had a head injury, that can start to then affect what's happening in the neck. The way to think of it is if there's a knock here, it can send a force that goes further down, and that can start to misalign those areas in the top part of the neck especially. And the reason is because of those top bones, they have the most mobility and they move in a different way compared to the other ones. So say we have this person here and they get a knock to the head. That then starts to affect these bones that we see in the neck. And the thing is, these top two ones here, these ones are uniquely shaped compared to all the other ones in the spine. So the ones further down, these have these what we call facets, which means they're kind of locked in place. Whereas the ones at the top, they can move a lot more differently and much more freely. And that means that they are in some ways much more adaptable, which means that we can have, so the brainstem running through, it can allow us to do a lot of different things. It allows the neck to be very flexible, but it does mean that there is potentially the susceptibility to be more of an injury, especially if there's certain types of accidents. And it doesn't have to necessarily be a knock to the head directly. It can be, say, if someone has a sudden jerking movement, such as if someone has a whiplash. Whiplash is a classic example of something that will really start to have that damage, and that can damage what's happening at that top level. And one of the reasons it's so important is this top two bones, which actually they look like this is the life-size model, is that running through the center here, we have the main parts of the nerve system called the brainstem, and this is a control center for your body. So if there's pressure on that brainstem, on that control center, it affects all the areas that it's controlling, which includes aspects of your breathing, your digestion, your heart rate, your balance centers, immune response, and what we call the cranial nerves. And the cranial nerves supply all the information around the head, the neck, the shoulder, and the arm, and to the fingers. One of the things that we see a lot here in the practice is called Meniere's disease. And the research very clearly shows that an average of around 80% or more people will have had some sort of head or neck injury in the past. For those of you who don't know, Meniere's is a problem with the inner ear. It's something where they usually go to see an ENT and maybe a neurologist afterwards, and it leads to vertigo, dizziness, it leads to fullness of the ear, and even a lot of, well, for most of the patients, there can be some level of reduction in their hearing or hearing loss on one side especially. However, a lot of the time, like I said in the research, it shows 80% have had an injury to the head or to the neck. And the time between that injury happening and the time between the symptoms starting is 15 years. So this is one of the reasons why myself and other ones of my colleagues, we may ask if there's been any accidents or traumas in the past. And it's very important to make sure that you do state if they have happened, because it gives more of an indicator of what's happening with your case and if it's something that can be helped with. As I mentioned, at that top level, we have those control centers for breathing, digestion, heart rate, balance centers, the cranial nerves, and also, of course, your immune response. So that does mean that if there is some sort of injury to the neck or to the head, and even to the shoulders, which may send this jerking force up into the neck itself and misalign those areas, it can start to lead to other problems and other health conditions. I've had a number of patients before who report to me they've had some sort of neck or head trauma. They never had any headaches, they never had any neck pain, they never had any issues with their shoulders, but they developed stomach problems. They develop acid reflux or gastritis, and that may come not just immediately, but say some months proceeding after they've had that kind of accident. So if there is an effect and there's some damage going on, it can really start to impact what's happening at that top level, affects that brainstem, and the brainstem then is what will really have a systemic, bigger effect onto the rest of the body. A way to think of it is, say if someone has, say, a hammer and they hit the side of a computer, the hammer may be the initial force. The computer now may be damaged because it affects, say, one aspect of it. But then that one aspect that gets damaged can start to have an effect on all the rest of it. Maybe it's a power part, and maybe it starts sending too much power, too little power to other aspects. And the same happens for the body. So in this part, we want to make sure, of course, there's no interference happening here. And if there has been kind of any injuries or damage, we need to make sure it's properly assessed. So that's why here at Vitality Chiropractic, we take a nerve scan, see exactly what's going on, and we always will take x-rays so we can see exactly if it's safe to do any sort of adjustments, especially if there has been some sort of trauma, and to make sure we know exactly how we should be adjusting to make sure things are as accurate and specific as possible. If anyone has any questions about this or head injuries or traumas in general, please feel free to give us a comment below. You can give us a call at 8438-9550 or email help@vitalitychiropracticcenters.com, and we'll be happy to make sure that we get back to you and try to help as much as possible.